Peptic ulcer, causes, symptoms, diagnosis, and treatment, presented by Dr. Muhammad Abubakar. Video script. Scene 1, opening, 00 to 020. Visual, animated stomach with title overlay, gentle medical background music. On-screen text, peptic ulcer, causes, symptoms, diagnosis, and treatment. Narration. Hello and welcome. I'm Dr. Muhammad Abubakar, and today we'll be talking about peptic ulcers, their causes, symptoms, how they're diagnosed, and the treatments that can help you recover. Scene 2. Introduction, 020 to 050. Visual, healthy stomach lining, turning into an ulcerated lining. Narration. A peptic ulcer is an open sore that develops on the inner lining of the stomach or the first part of the small intestine, called the duodenum. These ulcers form when the protective lining is damaged and stomach acid starts eroding the tissue. Scene 3, causes, 050 to 140. Visual, split screen showing H. pylori bacteria, NSAID pills, alcohol, smoking. Narration. The two most common causes are infection with a bacterium known as Helicobacter pylori and the long-term use of painkillers called non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen or aspirin. Other contributing factors include smoking, excessive alcohol use, high stress levels, and certain medical conditions that increase stomach acid production. Scene 4. Signs and symptoms, 140 to 230. Visual, animated patient holding stomach, icons for symptoms appearing one by one. Narration. The most common symptom is a burning or gnawing pain in the upper abdomen, often worse when the stomach is empty. Other symptoms can include bloating, nausea, vomiting, loss of appetite, and weight loss. In more severe cases, ulcers can cause vomiting of blood or black, tarry stools, both of which require immediate medical attention. Scene 5, diagnosis, 230 to 310. Visual, doctor talking to patient, animation of endoscopy, lab test icons. Narration. Diagnosis usually begins with your doctor asking about symptoms and medical history. Tests can include endoscopy, where a thin camera is passed into the stomach, breath tests to detect H. pylori, stool tests, or blood tests. Scene 6. Treatment, 310 to 420. Visual, pills, healthy diet, lifestyle icons. Narration. If the ulcer is caused by H. pylori, a course of antibiotics will be prescribed to eliminate the infection. Acid-reducing medications, such as proton pump inhibitors and H2 blockers, allow the ulcer to heal. Avoiding NSAIDs, quitting smoking, limiting alcohol, and following a balanced diet can speed recovery. Severe or complicated ulcers may require hospital treatment or surgery, but this is rare. Scene 7. Prevention tips, 420 to 5. Visual, hygiene, healthy lifestyle animations. Narration. To reduce your risk of developing an ulcer, wash your hands regularly, avoid excessive use of painkillers, limit alcohol, quit smoking, and manage stress through relaxation techniques and healthy routines. Scene 8, closing, 5 to 520. Visual, patient leaving clinic, smiling, Dr. Muhammad Abubakar, name overlay. Narration. With the right treatment, most peptic ulcers heal completely. If you notice symptoms, see your doctor early to prevent complications. I'm Dr. Muhammad Abubakar. Thank you for watching and take care of your health. On-screen text, presented by Dr. Muhammad Abubakar, for educational purposes only.